Hi, I'm Audrey Herbert. In this section, we'll be reviewing the point-of-care scanning technique for imaging the thorax. This cartoon depicts the placement of our probe for evaluating the pleural line in a supine patient. Both the Butterfly and Philips handheld machines can be used to obtain these images. The red circle symbolizes the indicator and should be positioned towards the patient's head, therefore taking an image through the short axis of the ribs and into the thorax. This clip was taken using a phased array probe. The top of the image is superficial, and the bottom of the image is where the sound waves are traveling into the chest. The left side of the image is towards the patient's head, and the right side is towards the patient's feet. You can see the subcutaneous and muscular layers superficially labeled on the right. As we move deeper into the chest, we then see the ribs. Superficially, ribs and bones appear hyperechoic or white, as the bone is dense and reflects the sound waves. Deep to the bone, we will see shadowing as no sound waves travel through the rib. If you now look at the center of the image, you can see a horizontal hyperechoic line. This is the pleural line. You can see that it is present deep to and connecting the inferior aspect of two adjacent ribs. Notice the movement, or sometimes described as ants crawling, along the pleural line. This is the artifact of the pleural movement during the respiratory cycle. Deep to the pleural line is the lung. As the lung contains air, it appears hazy on ultrasound as the air scatters the sound waves. Here's another image depicting the pleural line and lung sliding. Notice how the image resolution improves as the higher frequency linear probe is used. Again, observe the movement along the pleural line as the patient breathes. This clip again demonstrates the subcutaneous tissue, the muscular layers, the ribs, and the pleural line. Note that in this image, you no longer have the movement or ants crawling along the pleural line. This is a patient with a pneumothorax. The lung is no longer expanded, and the visceral and parietal pleura are no longer in contact to create the movement observed in the previous clips.